If you are an older man and masturbate, I need to ask you something. Have you ever wondered if it's actually healthy after 50 or 60 years old? Or perhaps you've privately worried that you might be causing some kind of invisible damage? If so, you are far from being alone. This is a topic surrounded by confusion, outdated myths, and a clear lack of reliable and clear information. This is one of the most common but unspoken concerns for men in their mature years. And after reviewing the available data, it's easy to see why there is so much uncertainty. Studies show that while most men over 60 continue practicing self-pleasure, many are doing it blindly, unsure of the actual effects on their hormones, prostate, or even their performance with a partner. That's why today we're going to have an honest conversation based on science. I'm going to guide you through 10 surprising benefits of masturbation in maturity, and then, crucially, 10 potential risks you need to be aware of to ensure your practice is healthy. Let's start with the good news. First, it keeps the health of the penis. The act of achieving an erection increases blood flow to the spongy tissues of the penis, known as the corpora cavernosa. Think of it like physical therapy. This regular exercise helps maintain the elasticity of the tissue, which is crucial for achieving and sustaining firm erections as you age. Second, it promotes prostate health. This is important. Multiple large-scale studies, including a historic one from Harvard University, have linked more frequent ejaculation with a significantly lower risk of developing prostate cancer. The theory is that regular ejaculation helps flush out potentially harmful substances and secretions from the prostate ducts. Third, it strengthens the pelvic floor. The rhythmic contractions that occur during orgasm involve key pelvic floor muscles, like the pubococcygeus muscle. A strong pelvic floor is vital for erectile function, ejaculatory control, and preventing urinary incontinence, a common issue for aging men. Fourth, it reduces the stress hormone cortisol. In our high-stress world, this is an incredible built-in benefit. Research has shown that orgasm leads to a significant drop in cortisol levels. Lower cortisol helps regulate blood pressure and reduce anxiety, making it a natural tool for cardiovascular and mental well-being. Fifth, it releases a cocktail of feel-good neurochemicals. Orgasm floods the brain with dopamine, the molecule of motivation and pleasure, and oxytocin, often called the bonding hormone. This natural mood booster provides a sense of well-being and emotional connection, which is invaluable for mental health. Sixth, it helps with self-detection of physical issues. The practice of self-pleasure makes you intimately familiar with your own anatomy. This regular self-examination is one of the most effective ways men discover early signs of conditions like testicular cancer, penile fibrosis, or other anomalies that could otherwise go unnoticed. Seventh, it improves sleep quality. After orgasm, the release of hormones like oxytocin and prolactin, combined with the reduction of cortisol, creates a powerful sedative effect. This helps the body relax deeply, making it easier to fall into a deep, restorative sleep, something that often becomes more challenging with age. Eighth, it improves overall pelvic blood circulation. Beyond the penis, masturbation improves blood flow throughout the pelvic region. This benefits the health of the bladder, prostate, and surrounding musculature, preventing problems related to stagnation and poor circulation. Ninth, it can serve as a training method for ejaculatory control. For men who struggle with premature ejaculation, masturbation provides a safe and private space to practice techniques like the stop-start method. This allows you to better understand your body's signals and build more control, which can then translate into partnered sex. And 10th, it keeps your sexual desire and neural pathways active. The brain is the largest sexual organ. By regularly engaging in sexual fantasy and physical stimulation, you are keeping the neural circuits associated with desire and arousal active. This helps maintain a healthy libido and sexual responsiveness, even if you don't have a regular partner. But to get the full picture, we can't just focus on the positive. A healthy practice is a conscious one. So now let's talk about the 10 potential risks or negative effects that you need to be aware of. The first risk is social isolation. This becomes a problem when masturbation stops being part of a healthy sexual life and instead becomes a substitute for real human connection. The solution here is awareness. Make sure this practice is complementing your life, not allowing you to withdraw from it. Second is the risk of micro-injuries to the skin. This typically happens when masturbation is done too aggressively or without proper lubrication. These small tears can cause irritation, inflammation, and can even become an entry point for infections. The solution is simple. Always be gentle and use a good quality water-based lubricant. Third is desensitization. If you stimulate yourself in the exact same way, with the same pressure and rhythm every time, your brain can become conditioned to that specific touch. This can make it difficult to achieve arousal or orgasm with a partner. The key is to vary your technique, rhythm, and approach. Fourth, it can mask underlying causes of erectile dysfunction. If you can only achieve an erection during masturbation, but not with a partner, it may be tempting to ignore the problem. However, this can mask serious underlying health issues like heart disease, diabetes, or hormonal imbalances. If you notice this pattern, it's essential to see a doctor. And speaking of underlying causes, I need to pause here for a moment because this is critically important. While this video gives you the what, I want to share a resource that explains the why and offers a powerful natural solution. It's a video presentation that I think is essential to watch for any man concerned about his sexual health. It reveals an oddly simple 7-second home remedy developed to address what new science suggests is the true root cause of many of these male performance problems. This isn't about masking symptoms, it's about a 100% natural approach to restoring your youthful firmness and stamina. I strongly urge you to watch it. Point your phone's camera at the QR code on your screen right now to open the video. I've also placed a direct link in the pinned comment below this video. Go ahead and open that link in a new tab so you can watch it right after we finish here. Now that you have that resource available, it's crucial that we cover the remaining risks you need to be aware of. The fifth risk is nerve compression due to poor posture. Many men masturbate while sitting on a hard chair or slouching, which can compress the pudendal nerve in the pelvis. Over time, this can lead to genital numbness or pelvic pain. The ideal is to practice in a relaxed and comfortable position, such as lying down with appropriate support. Sixth, it can become an unhealthy emotional escape mechanism. Using masturbation as your only tool to deal with stress, boredom, or frustration can create a behavioral dependency. It's crucial to have a diverse toolkit for managing your emotions, including exercise, meditation, and talking to others. Seventh is the feeling of guilt and shame. Many men were raised with powerful cultural or religious taboos about self-pleasure. If these feelings persist and cause distress, it can be incredibly beneficial to speak with a therapist or sex-positive counselor to help reframe this natural practice in a healthier light. Eighth is pelvic congestion. While infrequent ejaculation is a risk factor for prostate problems, excessively frequent ejaculation, multiple times a day over a long period, can sometimes lead to a feeling of heaviness or pain in the testicles and pelvic area. The solution is moderation. Listen to your body's signals. And ninth, it can potentially impact semen quality. This is only a concern if you and a partner are actively trying to conceive. While it doesn't harm your long-term fertility, ejaculating daily can temporarily lower sperm concentration. For optimal quality, studies suggest a period of abstinence of 2 to 5 days is best. And 10th, a disconnection from reality, often linked to pornography. If masturbation becomes overly dependent on extreme or unrealistic pornography, it can skew your expectations and make it difficult to connect with a real-life partner. The key is to balance any visual aids with your own imagination and memories of real, affectionate experiences. So as you can see, masturbation after 60 is not simply good or bad, it's a tool, and like any tool, how you use it determines its effect. The secret ingredient is always awareness. Practiced with consciousness, respect for your body, and moderation, it can be a powerful and wonderful ally for your health and vitality. I hope this conversation has been helpful. I genuinely would like to know what you think. What was the most surprising point for you today? Leave a comment below. Let's continue this important discussion together. If you found value in this video, please like it and subscribe for more direct and well-researched health tips for mature living. Don't forget to hit that notification bell so you don't miss our next conversation. Stay healthy, and I'll see you in the next video.